Hi, the purpose of this video is to demonstrate Infiltrate scoring and measurement and documentation for PIV infiltrates. So the first thing we're going to do is we are going to show you how to do the correct measurement for a PIV infiltrate, and we'll talk about scoring and how to document. So when measuring, the measurements are in centimeters, and you measure from the axilla on the inside of the arm to the third fingertip, and you get your measurement, which looks about 15 centimeters. And we measure the infiltrate, whatever the longest measurement is. It could be the width or the length. So it's 3 centimeters. Then in EPIC and in our policy for PIVs, there is a diagram that you can look to see the formula to do the calculation. And you'll see that you take the measurement of the infiltrate and you divide that by the arm length and you multiply that by 100, and that gives you the percentage of the infiltrate. Also, in taking into consideration, you have to look at our medication list, which is also in the policy. And if the patient had any of these medications infusing at the time when the infiltrate happened, we take into consideration the category of what, if it was a low risk, intermediate risk, or high risk medication, and that also is in the calculation to determine the severity of the infiltrate. So if the medication, if the swelling was less than 30% and the medication was in the green or yellow category, it would be a mild infiltrate. If the swelling was greater than 30 up to 60% and the medication is also in a green or yellow category, it would be a moderate infiltrate. And if it was a severe infiltrate, it has swelling greater than 60%. The medication could be in the green category, but if or yellow or red. But medication red level is always a severe infiltrate, regardless of the amount of swelling. So take those into your consideration and then document appropriately. We follow the algorithm in EPIC for as far as following our documentation pieces. Also, make sure that when you do document, if you have a moderate or severe infiltrate that needs continuous documenting for up to 24 hours or longer, that's passed on from one shift to the next. Key points to remember about peripheral IV infiltrates is always have your charge nurse be your second verifier for measuring, and contact a CNS if needed for put a referral in for CNSs if you have an infiltrate. And then also, if the patient does not is contracted or does not have cannot unbend their arms or does not have arms, we would measure from the groin in the inside of the groin area to the end of the foot. You would extend the toes as much as you could and measure to the longest toe. Regardless of where the infiltrate is, you always take the measurement in the arm from the axilla to the fingertip. So even if the IV was placed in the foot, the calculations are based on body surface area, and the formula for calculating is from the arm to the fingertip, or of course, like I said, from the groin area to the longest length of the toe if you don't have arms available.